Шановні колеги, ми продовжуємо.
Dear colleagues, we continue our work, and the topic of our current press briefing is as follows: key bill of medical reform, whether it contradicts to the articles of the Constitution of Ukraine on free medicine. Mr. Pavlo Kovtonyuk, Deputy Minister of Healthcare of Ukraine. Dear colleagues, good afternoon. Today, we would like to inform you about very important news. We now are prepared to make the healthcare reform in Ukraine irreversible, that is, to submit to the parliament the necessary legislation, and we discussed much about the reimbursement for medicines, for family medicine, for the hospital districts, etc. But no reforming will be possible without proper legislative framework, and we have to ensure that the reform course should be irreversible. That's why we have to pass necessary legislation. That is, within the next 3 years, which are projected to become the reforming years, and the funding for 3 years is projected already. We have to submit, and now I would like to speak about the package of bills, but there is one main law among them, the main bill among them, which I would like to mention. The Ministry of Health, together with experts from the World Health Organization, WHO, had been working on the bill, on the main healthcare bill in Ukraine for 18 months, and we had finalized that this is about international financial guarantees for delivery of for delivery of medical services and medicines. As you can understand from the name of this bill, this is about state guarantee state guarantees for healthcare services to delivered to people. As of now, each household pays up to 4,000 hryvnia for Medicare. Let's assume that all this money, 4,000 hryvnia, would be allocated to the insurance company, whether it would get the same services as it gets from the state. Each year, 640,000 people experience the disastrous medical expenses because of serial illnesses. In Ukraine, of course, we have money allocated for health care. But of course, they are insufficient on the one hand. On the other hand, people should know what they can get for 4,580,000 hryvnia. So these allocated funds would guarantee the delivery of a state guaranteed package of healthcare services, and each year people should know what services and the amount of those services which will be rendered to them by the state. Moreover, this money should follow the patients and the medical institutions thus will know in the future how much money they will get having treated this or that patient. And we have to recognize international medical protocols in Ukraine. Ukraine cannot develop its own multiplying table, and we should not invent the wheel. We should pass the international medical protocols. What should people know about this draft law? People should know that there is specific coverage from state budget for the medical services delivered to people. This package will be unified for all citizens of Ukraine. Now we follow the principle of universal coverage, and we say that irrespectively of the income, the state guarantees some specific services in specific amounts to be delivered to people. This package will contain red list, green list, and blue list. The red list, this says what is not part of the guaranteed package. These are non-critical services. This is aesthetic medicine, stomatology for adults, except emergency cases, etc., and applications without appointments with doctors, without special direction, and the medicine of unproved efficiency. The state will not pay for those medicines which are not in the international treatment protocols. The green list, these are services covered at any circumstance. Emergency service, this is when there is a life threat, and when there is a life threat, people should not think about money. And today, when the emergency car, ambulance arrives, people start thinking about fuel and about future treatment in hospital. Then the first aid, this is the cheapest and the most efficient in the West. 80% of all the applications they are resolved at this very level, at the primary aid and palliative aid. This is the last stages of diseases like hospices. And the blue list, this is these are services covered both by the state and the citizens. there are special tariffs set for these services. This should be unified tariffs. They should be accepted by all the hospitals and polyclinics, outpatient hospitals, and these jointly paid services could be paid by people and by the state or by companies.
Also, what could be the ways of paying? First of all, the person could pay less, and the private through private medical insurance, the market for it becomes much bigger. The prices in the market of private medical insurance will become much lower. If a person wants to get insured, could do that. For those citizens who cannot do it, there will be the programs of the target additional social assistance, but there should be a source for each of such program so that citizens do not pay anything additional. The same package of laws gives an example of how this could be implemented, and that will be the first national program of additional guarantees for ATO warriors who were wounded in ATO, and we describe the mechanism how you can cover 100% treatment of wounds and disabilities and damages, and also 100% life coverage for those who receive disability. So we follow the principle, the money from a known source follow the patient. Also, we create the National Service of Health of Ukraine as the operator of that guaranteed package. Such services exist in many countries. Here are the logos of the countries of such services from Norway, Spain, Italy, and Great Britain. This institution pays for medical services according to the agreement, and it pays to any institution of any form of ownership which is selected by the citizens, which includes the private medical institutions, the sectoral medical institutions, and so on. It also pays it according to clear tariffs which are known in advance. That means that there could now be a case when a patient comes to the hospital and the hospital says, our services are much more expensive and you have to pay more, and the tariffs are known in advance, just like as tariffs for communal services. When could that start technically? We can start doing it when, you know that back in 2017 we mentioned that we will start this principle from the primary medical assistance. We are ready to start it from the middle of the age. In 2018 and 2019, the diagnostics and specialists and others are to join the system. In 3 years we will have the situation when, even if a person is poor, when a person goes to the hospital, there will be the assistance in a very clear volume, and you will not think about the money, and the doctor will not think about the money. The manager of the hospital will think about money, and he will be signing the agreement of insurance and the agreements with different sources. All money will be cashless. It will be cashless. We are moving to the relation between the patient and the doctor, which will be cashless. Then why do we need to pass this draft? Not because we are in such a hurry only, but because technically for this system we need time. We need 3 years. And we know that if today we launch the initial primary medical assistance, and then in 2018 we'll start the secondary medical insurance. Then in 2019 we will launch the guaranteed package. If we don't do it this year, we fall into the situation when we will start talking about that next year, and then we will be trying to introduce it in 2019, 2020, which are the years of elections, when no one will be implementing the reform of the medical system. So to go back to this discussion, we will be able not earlier than 2021 or 2022, but I can assure you that this will be same type of discussion, because there's no alternative to that system. The system itself will be just like that, and not to go back to this discussion. In 5 years, the state of Ukraine can pass a decision today, having passed the package of draft laws that we submitted and which was approved during the presentation at the meeting of the Cabinet of Ministers of Ukraine. Thank you. Now we will have several questions. Please introduce yourselves. The questions only on the topic of briefing. ICTV. I would like to clarify some specific things. Please tell the analysis, cardiogram, other things, will they be paid by the package? Yes, they will. But who will pay? This will be paid by the National Service of Health. It just depends on which part will be covered by the state and which by the patient. Every year the Cabinet of Ministers will give the list and will know the tariffs for the next year. What do we pay from which source? What about oncology, the stroke? What will be happening with this? Because now they don't take a person to the surgery. They ask, do you have money or not? We need to understand that this law is introducing the system under which we will have answers to for every year, according to the state budget and the priorities. I don't want to give you any details because I don't know them. I want to introduce the system under which the Ministry of the Health, the National Service of Healthcare, and the Cabinet of Ministers will have to calculate it for every year based on clear priorities, which Ukraine will have to pass via the resolution of the Cabinet of Ministers. What I mean today, the priority will be number of money, reduction of death rate, and on that, and the list will be also approved according to that. But now the question is whether we switch to this system or not. But there should be everything specific, because everything is here without any specificities. Now you cannot say whether the state will cover strokes or other things. The state will cover in this system the whole spectrum of services, but to what extent it will cover the cost of every service, this is to be calculated. The first guaranteed package will be calculated on the 15th of September 2018. Does it relate to such diseases as Alzheimer, Parkinson? Will this also be co-financing? I can tell you only what I think. I think yes, but again, for that, the cycle of development of the first guaranteed package of guaranteed medical services is to be developed.
1+1 TV channel. You mentioned the price on services will be similar in all the hospitals and outpatient hospitals. Now there is big difference in prices, so the price might be different, but the tariff, how the service will be paid, will be different. This will force many hospitals and outpatient hospitals to become efficient. The private hospitals and outpatient clinics will decide whether it will be beneficial for them to work under these tariffs. But for them, it will be also beneficial to do this because having received state order in advance, they will they will get their profits with big numbers of patients. Elena Sergeyevna, OS Ukraine company, whether this reform has any view on psychological and psychiatrical diseases. When we speak about psychiatries, it's more about medicines, or when we speak about psychology, then this is about psychodiagnostics. Your question just showed how the budget for the budget for the next year will look like. Let us assume that psychiatric clinic says we need that much money to pay for heating and to pay salaries. Now, then we will review whether our psychiatric treatments comply with the international treatment protocols. Then what parts of bills for each disease the state will be able to cover. As an expert, I believe that psychiatric aid should be affordable for people, but the specific set of mix, how much should be covered by the state, how much should be not paid. Unfortunately, the biggest problem in Ukraine, then in psychiatry, we follow the processes from the mid last century. I'm a stomatologist, so I would like to know whether prevention measures in stomatology will be covered. For example, in dentistry, for example, for children. I think there will be the same approach then to psychiatry. When we have reviewed the examples from other countries, we have observed that the state covers in dentistry just one thing: preventive dentistry for children in order to prevent problems. I think that for the country with such a budget limitations in such a country as we have, that dentistry in general for adults will be covered privately. Lvova Medical Center calculating tariffs for Kiev and Ukraine. We have been working for 20 years. I have information for you. Dealing with this problem for many years, I can share the biggest problems with you. 90% medical institutions in Kiev have their tariffs, and all those medical institutions have to confirm with the Ministry of Justice the tariffs. You mentioned that individual tariffs will be set for all the medical institutions. I should say that this should be done in first turn, because immediately after development of these tariffs, then the coordination procedure, improvement procedure for these tariffs sometimes takes more than 1 year. So if in your programs you will have the pricing issues which are part of insurance programs, etc., without proper pricing, without proper procedure for improvement of this price, and we will be unable to work. You mentioned a joint tariff or unified tariff. As of now, we okay, I will answer one by one. Now, tariffs for so-called paid services have to be coordinated by coordinated with the Ministry of Justice in a system which we will establish. The tariffs will be set by the national healthcare system. Why? Because why not to pay everything to the hospital? If we introduce healthcare, paid healthcare services today, we will have much inefficiency in the system which we have to now. There is a hospital in one of the regional centers, and in this regional center, in this city, there is one big enterprise. The hospital and outpatient clinic was built to satisfy the needs of 80,000, 100,000 people. As of now, there is only 25,000 residents in this city, and there is a huge inefficiency. They have 6 buildings why they do not see any patients. So the quality of the medical service will not be good as of today, and very expensive. That is very inefficient. So we will take the first year as a pilot year, and thus, we have to launch the optimization process. This model has been working successfully for many years in all the developed countries, and all those developed countries are ready to provide technical assistance to us, and